Hey, Del Nacho's crew, it's Paul, Dr. Nacho. We are here on this interesting Monday where dentistry has been grounded like me as a teenager. And we are going to talk to dental students about what is affecting them. We have some awesome dental students and dentists in the Zoom chat. If you want to win a prize, you got to watch it on Zoom. You can also watch it on Facebook Live, ask us some questions. So what I wanted to do was to bring you guys two real dental students, which we did off the pages of Instagram and Facebook. First, we have Dr.to-be Jordan Brown. Jordan, introduce yourself to our audience. Tell us where you are in the circle of dentisting life, what you got going on now, and what you have planned for next year.
All right. So in the circle of dentisting life, I am a fourth-year dental student at the University of Michigan. Plan is to finish an AEGD, one-year AEGD back in Florida, where I'm from. And after that, I'll be working in a community health center as a part of the National Health Service Corps scholarship program.
Awesome. Thanks, and you are a bad in training, a baby exist in training. I want to bring Abdul. Let me just see. I want to unmute him. Ariel, did I do anything to Abdul's mic here? You're okay. No. We're good. All right, good. Now, Abdul, introduce yourself to the Nacho crew.
My name is Abdul Al-Karaguli. I am a third-year dental student at the University of Buffalo School of Medicine. I haven't applied to residencies yet. I haven't even taken the boards too, which I was supposed to be taking in a few weeks. But that's where I am at in the dentisting cycle, I guess, the dentistry cycle right now.
So when you guys, thanks for introducing us, thanks for being here. You guys will learn as practice owners, as dentists, associates. You know, you learn a little bit in dental school. So it's like your day's very chaotic. And sometimes you just have to stop and orient your mind. What are you doing next? What procedure are you doing next? Who's complaining next? So let's just take this into the coronavirus crisis. Tell me, Jordan, what's going on in your dentisting life now? School closed, school open, graduation, no graduation. Tell me what you know, and then tell me what you're looking to find out.
Sure. So biggest thing is that graduation for us was canceled. That was a few weeks ago. They kind of gave us that hammer on, hey, it's okay. I mean, of course, you know, we spend all our lives looking forward to graduation, but it's more symbolic than anything. Yeah. But also right now, clinics are all closed. I think there's maybe one or two faculty members just at the school seeing emergency patients that come in. But for all the fourth-year students right now, our clinics are closed. We're not seeing patients. And then we have been assigned kind of online modules to go through as a way to just get some engagement clinical-wise.
Now, tell me, how close was everyone to requirements? Like, is there stuff people are going to have to come back and do? Are they going to let people go? What's the story there?
Sure. So Michigan itself is competency based. So whenever you feel like you're ready to do that crown competency, you just go ahead and do it. So our classes kind of, I guess, split if either you finished everything or if you haven't finished some things. So the school right now is trying to figure out what they can replace with an online module or paper or an assignment and other things that they can't. So they haven't told us, at least yet, which procedures and which test cases and which competencies can be replaced with an online assignment. And so for those people that may have one or two things left, they may be able to do an online assignment. But if they are missing, you know, 2 root canals or they haven't done a denture yet, and those students may have to come back later on in the summer or early fall, whenever things kind of.
I want to make, you know, I like to pause and, you know, this is hard on everybody. It's hard on the dental schools, hard on the dental students, but we still can use leadership and good decision-making. I saw you on my friend's show, D'Angelo Webster, right? D'Angelo's your D'Angelo.
Yeah, Dr. Webster, yeah.
Communicating because he's in Michigan. Now share with me, where is Michigan in this timeline? Do they have a reopen date for dentistry right now?
I'm not 100% sure. I think that the governor just extended the stay-at-home order through at least April, I believe. And so for us, at least, our last week of clinic was supposed to be this week now, if nothing had impacted it. And so, I don't know, I think it's going through at least April at this point.
I was just talking with one of my friends, and Mark Costas. I don't know if you're familiar with the Dental Success Institute.
Absolutely.
He's an awesome leader. And we were just talking about this as, you know, 40-ish-year-old dads and dentists. And one of my concerns is I'm starting to get this sense that things are losing momentum. And, you know, to use your gym term, you talk about gains, right? You know, people step on the scale. I want to lose weight. You want to gain weight. It's like 3 more reps.
Right.
But it's like we should have something daily that gives us an update. And Rob Montgomery and I, my podcast partner, Dental Folks Attorney, I just think we need more updates. Like we need more input. Like, you know, it can't just be because Paul wanted to jump on Dental Nachos and talk to people. This is kind of like a club, right? This is great. It's a great club. But I just had David White on from the ADA. And I think one of the challenges, you know, you guys are Instagram guys, and we talk about in Dental Nachos MOC, mechanism of connection. So I have to tell one dental student that our lecture on Saturday moves from 10 a.m. to noon. I could Facebook them, Instagram, text them, email, call them. And that's where I think we're having some real challenges in the dental world of us all connecting there. So great start. Thanks, Jordan. Now move over to our D3 student. Abdullah, tell us a little bit about where you are in the dental circus. I know you're a D3 student. What's going on at Buffalo?
Currently, Governor Cuomo just extended our stay-at-home order as well. So technically, we're not going back as of right now. They don't have a solid timeline. They have been working around the clock at the school. I've been contacted with the admissions office a lot to see what's going on. And so they're changing a lot of the rules, of course, the PPE selections. I think what they're trying to do is to get the D4s as soon as possible back to clinic while maintaining social distancing. I don't know if you remember how the dental schools are like, you know, the chairs are right next to each other.
Yeah.
So technically you have to like create some sort of that distance. Some schools even created doors and closed areas for students. They can, you know, finish their requirements. So Buffalo, what they're doing with graduation is that they canceled graduation as of right now for the D4s, but they are planning a fall ceremony for the students to come back and have their graduation afterwards as well. And that's like in the planning.
I mean, I appreciate that nice, but some of the things I talk about Dental Nachos, you'll see. So when people have an idea, at Dental Nachos, we draw a little stick figure, then we say ID in development, and CTC means we completed the circle. It could be anything, a C course, it could be how we talk to people. I just think these dental schools, they need to move some of this process forward, because I've been contacted by a lot of D3s. You guys are essentially, what you're learning right now in dental school, like an online course, or what's going on right now?
So, I mean, D3s are not going to be as effective as D4s. So like with D4s, I know they're going to remove a lot of the competencies or requirements as much as they can to make sure that they graduate on time. The D3s, on the other hand, they're just postponing. So a lot of our classes are going to be incomplete. So technically what they're trying to do is basically cram in all the lectures and the didactics so we can finish them early, but all the D2s, the D1s as well. So by the time we come back to clinic, we just have clinic every day to catch up on the requirements that we've missed. And that's how it's working for the D3s. D4s don't have the luxury of time. A lot of them are accepted to residencies or jobs, so they don't have next year to catch on. For us, as of right now, there's not a lot of elimination for requirements, but there's a lot of postponing of requirements. So technically, a lot of us are going to receive an incomplete grade. It doesn't affect your GPA. And Buffalo just completely changed their grading scheme to a pass-fail. We're graded as a school. And they're giving the students the option to choose whether you want to do a pass-fail in the course. And that's just, so basically you can still have a letter grade, or you can elect to have a pass-fail grade if you think it's unfair, you're being unfairly evaluated.
Yeah, I appreciate their attempt to figure out a way to get through this next time, but also there's like, I'm going to use my example of, you know, Orange Theory Fitness. Do you know it, Jordan? Do you ever go there?
Yeah.
Absolutely. Like the bench, They just give you a treadmill. You just bench press that. It's like, you do your own thing over there. Pick up your treadmill. But I like that, right? For a dad, I go in there, I do it, it's done. And they froze my membership, which I thought was good customer service. Like, they didn't charge me anything new. They didn't set a cancellation fee. What is the dental schools, I'll start with D3s, what are they doing about your tuition? Refund, credit? What's the conversation about that happening?
So when it comes to money, of course, all of us have asked about it. We have a lot of CMS fees and clinic fees. And the schools are basically, I mean, the University of Buffalo itself, not the dental school, has refunded all students for, housing, and refunded them for classes and discounted a lot of their courses. The dental school itself are working around to see how they can do that as well. I mean, keep in mind that for the D3s, we still have to take these courses.
Right.
So even if they remove it, does that mean we have to pay it back again later on? Does that mean we have to stay longer? So they don't have a set refund for our basically tuition and also our clinic fees, but we received emails saying that they are in the work and there's a lot of changes that are happening.
I'm glad to hear that, because I mean, it's an important thing, because it all stinks. It stinks for everybody. Everyone's going to feel pain, economic pain, but that pain should be shared, and they should figure out a way for it to make sense. And maybe they add clinic time back later and you do pay more later. Maybe they guarantee that happens. And I just think everything, I'm a real leadership type person, like read leadership books. And I just sometimes dental schools, their leadership sometimes can be, let's say, old fashioned in a way. And I think they just need some, I mean, honestly, I believe they need like a crisis management team. Like, these are giant organizations in charge of millions and millions of dollars, and they have to decide what to do with it. It's not, to me, I mean, it's not just the dean and the assistant dean thinking about sitting around saying, what do you think is good? They should actually bring in someone from the outside, I believe, to give some insight there.
Yeah, and the school itself have been doing a lot of these. Like we have a lot of webinars and WebExes, but there is like a silver lining here. Like, that you can see a lot of these courses and didactics that we have, they all switched to online and they're still working fine.
Yeah.
So the future of education right now, this was going to be the future. Online courses was going to happen. But with this, they sped it up. Like now you have to have online education. And in the future, I mean, if we have online courses for the didactics, you gave the students about 3 to 4 hours of their day back. You don't have to like get up, find a parking spot, clean the snow.
It's really important. It's going to happen with C too. I mean, I don't know, Peloton, like I've modeled a lot of what we do with Dental Nachos around the Peloton, because they have their in-person courses, they have their live classes where you feel like you're part of it and you watch a recorded class. But from a physical fitness standpoint, you can consume that at any time. And they should do the same thing for learning. It's archaic. And I believe that the future of live CE, which I still believe in because there's merit to getting together. Like you guys are going to want jobs. You can't find a job virtually. You're going to have to bring your human form to a CE course, meet a SAD, meet a MAD, but you don't have to do all your CE like that. You won't have to get up on a Saturday and eat fettuccine Alfredo at 11 a.m. and watch a pharmacology lecture. So I believe that is a good silver lining there, Abdullah.
Yeah, I mean, for me, I always like try to look at the positives of it. And as I said, it's different for D4 than D3. For D3s right now, it is a weird time to be. Of course, we just started developing our hand skills, and we just started, like, we start seeing patients from technically early on second year in the University of Buffalo. But heavily third year, that's when you're doing your crown preps, you're doing all your class 2s.
And also, guys, I mean, this cuts, I have 2 practices, I have associates. This is for anybody who has to see a dental patient. A D3 taking 3 hours for a bite rim and me taking a half hour for an implant impression. We're all in the same boat. We have to get the patients to want to come back too, which is a challenge. Just because we say we're open doesn't mean everyone's going to come rushing back, dental student or not. Now, Jordan, I want to switch over to you for a minute. So you're a D4 about to go into this residency program.
Yes, sir.
Have the residency program been giving any input on what they're doing, or are they just sort of in a holding pattern right now?
Sure. So funny enough, I was actually speaking with one of the current residents now, just asking them about, how the University of Florida is kind of handling their requirements. And so similar to kind of D4s at the DDS level, they're doing CE courses on either clinical dentistry or practice management. And they'll have 1 or 2 people at the actual clinic seeing the patients. But for us, since we're set to begin later on in June, they haven't really told us anything yet because hopefully they're planning on this maybe blowing over by then. So
I mean, we'll the residency programs have different requirements, but they still have some requirements. And it's, they're challenging. Now, let's move. So I like your comment, Abdul, about being positive. I call myself positive, but also realistic, right? Yeah. So in Philadelphia, if you want to go to my favorite place, Alvez, on a Friday night without a reservation, I'm positive you're going to have a good time. But realistically, you're going to wait 2 hours for a table without a reservation. I'm not being mean. I'm not being negative. I'm just telling you that's the scenario. Yeah. What are some concerns, and you can represent your classmates, about the next step in finding jobs? Have people been talking about, hey, you guys might have upperclassmen, what's happening with their job? A lot of this is just talking. I'll start with you, Abdullah. Have you had any insight from any of your friends about associateships or concerns about that?
I mean, the job market itself has been, I think it's been directly hit in terms of like associateship and pay and whatever. Like you mentioned, patients are, a lot of people lost their jobs. They don't have a lot of disposable income to get a lot of cosmetic dentistry, for example. So I feel like in the next few years, people, like you mentioned, are going to be coming in for emergency, or they really have to come in until, the market or they get back their money or whatever, they start making money more and they can like do a lot of these cases. But for us, I'm planning on doing a residency program. I'm a little concerned about like what the residency programs are going to be like, but it's completely different than somebody that's trying to get a job.
It's
right
a smart point, because you could still say the right word isn't hidden, because I did a multi-year GPR, but like you're going to a AGD, you're just in a very standard environment that's not a business environment where you don't lose your job if they don't have enough patients. So I think that's a key point. Jordan, how about some of your friends who maybe have gotten job offers, and it might just be up in the air, but just wanted to share some of your thoughts on that.
Yeah. So I spoke with a few of my friends today, just asking them how the job search is going. A few of them have already solidified their jobs in the owner in private offices. And so for the owner docs that offered them that position, they're hanging tight, like they're staying with that. But for those people that haven't solidified a job yet, they're finding that private practice dentists, if they have already had an associate and they've unfortunately laid them off, they're most likely going to bring on that person before they bring on a now graduating dentist. And a lot of them are now headed towards corporate when they weren't necessarily going that way, because those are the only people that are actually offering contracts right now.
I mean, really good insight there. And that fits in my thing, like ABE, always be exploring, always be flexible. So if you're sitting there thinking like, am I going to get a job in September? I don't know, but you can always be differentiating yourself. One of the things my team, I did a 2-hour segment with the Einstein residents about how to differentiate yourself, called, not surprisingly, crunching your job interview. Get it? Crunching. So if you would like that segment, you just email salsa@dentalnachos.com. You guys too. So I brought in an interview expert about how to interview and how to differentiate yourself. So while you don't know what the job market's going to be like, while you're sitting at home between bicep curls, you can make a video of yourself. You can bring yourself to life. You can take CE. And I've been doing a big thread on what's going to matter is patient communication, because we're going to have fewer patients. This is for dental students too. You got to graduate. We're going to have, any way you cut it, we're going to have fewer patients in dentistry for the next 12 months. So you have to connect with those patients, and you really have to up your patient communication game, because you have to be able to get the most out of your patients ethically, responsibly, but also for the success of your practice. And I do feel that this fourth year, first year out of dental school, second year out of dental school is a challenge, because before this, I talk about, do you need an associate or do you want an associate? Do you need one or do you want one? And the better jobs are where they had a need for an associate, and that need has changed, because I'm a practice owner. We have awesome associates. When we can reopen, like opening day for dentistry again, I literally have no idea what type of patient volume there's going to be. So I'm going to have to test it out there. So I would encourage you and your classmates to use this time to increase patient communication. One of the things we're giving out here is Lies and Loans, Life After Dental School. It's such a key time to practice this because you have the downtime. Let's go to a couple questions here for our panel here for a second. How do you think this will impact the associate job markets going forward over 1 to 3 years? I think there's going to be a contraction. I think, I don't know if you ever have a cheat day on your diet, Jordan. Abdullah, it looks like you and I, my whole life is a cheat day. But like, you guys have this has all happened to us. We've all been sitting, it's happened to me too. And you've been sitting across from someone who says, I can't have a piece of cake, I'm going to get fat, right? But it's not realistic. That's how their mind is at that time. And I'm not blaming them. Owner dentists are going to feel that way. We're going to feel that we don't have enough, and we're going to have to transition. So one of the things I'd share is anything that you can bring to a practice that's Nacho ordinary, Invisalign, implant placement, even extractions is a great one, right? So anything that you can bring that's unique, and you could say to a dentist, hey, maybe I'll work 1 day a week and I'll do some of these other procedures. Good question there.
So Paul, do you think that the impact of COVID now on those older dentists now, do you think they're going to use this as that final straw to go ahead and retire? Or do you think that they're going to see this and say, okay, well, now I have to keep on going for another 5-6 years?
This fits with ABA. Such a good question. It's going to be all over the map. I've done so many webinars. So I said, this is going to happen. So I have a town with like 10 dentists, right? I'll tell you right now as I'm sitting here, one of those dental practices will not reopen. It just won't, right? They do 300 grand a year, satellite practice. Weird stuff's going to happen. Someone's just not going to show up back up at their job again. So be open to that. So I do think there's going to be mid-sized practices that may say, hey, now's the time to be done. But to just complicate this issue further, because I'm a practice transitions broker, and I had 2 or 3 deals closing in April that are now on pause. No one knows right now what kind of loans the banks are going to give for practice ownership in the next year. But I do think, look for any time there's a void, anytime a dentist is saying, I'm done with my practice, it doesn't mean run and go buy it. It just might be a practice in the area could absorb it. So I think a lot of crazy stuff's going to happen initially, and a lot of it's going to do with the PPE and the requirements for our offices. The more requirements we have to do to an office, the more likely some SADs and GADs might just say, I'm done. And I don't blame them, right? I don't blame them. Really good question. For D4s, did your school modify the graduation requirements? Did they?
Sure. So right now, I think we're supposed to get an email today about whether on each person's individual pathway to graduation. So luckily, I finished all my clinical requirements already, and so I'm not too worried about them clearing me for graduation. But the school itself has to go through every single student to see what they have done, what they haven't done, and they have to see if they can either reduce it or eliminate it. And so we're still waiting on that email now, which is
probably
kind of
do something that makes sense. What they should do is I'm speculating from my days back in dental school 17 years ago, or maybe almost 20 years ago. Like, they should get out some of the junk that isn't really key, like, I don't know, number of fluoride treatments people do, or some other things, so that they just start to manage it that way. Maybe this one's for you, Jordan. Why hasn't Dr. Nacho been interviewed on the Dental Vibes, Student Vibes podcast Jordan Brown has?
So Student Vibes, some of my friends, I believe they're down in Florida. I believe dental students, they have a podcast. They've interviewed a lot of great dentists. I think you're an awesome guest speaker you can have on there. So I'll connect you.
This is what I do. I show up in this sweatshirt and I talk. My expertise. Abdullah, or maybe it's more for Jordan, because I don't know if you're there yet. CDCA ADEX licensing exams. I know some students took their licensing exam, but they might have to retake them. What's the word on ADEX CDCA?
Sure. So for CDCA, they canceled all their board examinations, I believe, through April now. So if you either haven't taken it or need to retake one part of the whole section or whatever it is, that's on pause. So how this relates to licensure is that, for anyone who doesn't know, if you're a younger dental student, you have to pass all sections of either the ADEX, CCA, or the REB or something to get your dental license. And so in Michigan, at least, I believe they just pushed forward this temporary licensure during the government shutdown. And so now in Michigan, if you just graduate dental school and fulfill everything else besides the board requirements, you can apply for a temporary license that's good for 6 months from the end of the shutdown. So, which is nice because you can still get your license if it's good work. But in the eyes of an employer, it's like, okay, well, is there even a market for bringing on an associate? And it may or may not look so good if you just have a temporary.
I mean, this is one of the things that I call about, Abdullah said that great comment about being positive. We also have had sort of a switch from JBN, which is my normal, you want to fight over PFM, zirconia, be nice about it. But this really is JBR, just be real. And I mean, I kind of liken it to my children, right? If a babysitter showed up and was like, I got a temporary babysitting license. Can I babysit your kids? I'll be like, you seem okay. That's just a hard thing. It's hard for the student. I feel for them. But I also, it's a very confusing, one of the things we're giving out is confusion is the killer of case acceptance. One of my patient communication courses. It's hard on an owner to be like, okay, I'm going to hire someone out of dental school. Now they have this temporary license. And I also don't think that these are these things where it's like this, I don't know if you guys have the PPP loan, the EIDL loan. They said it was going to be good, and now you look into it, and it's like so confusing. So they might say, oh, we're going to give temporary licenses, but what does that mean? So a couple more questions. We'll let you guys get on with your day. How do you think this will impact private practices? Will DSOs use this to their advantage and expand their influence? Do you guys have any insight? You were saying about more DSO positions. Share with me about that.
I mean, personally, from looking into it, they will definitely expand on it. Like you mentioned, a lot of dentists right now are in trouble, and some of these DSOs are a lot more influence. They can change the practice model based on a significant number, and they can actually provide those PPEs, and they change those requirements based on whatever they're required to do, while single practice owners might find it to be more troubling. And right now, I'm pretty sure a lot of these practices have lost a ton of value. And for some of these companies or corporates, when they buy into these practices, I think this is also another way of the shift that's going to happen. Like corporate was supposed to take over in a couple of years or whatnot. This is going to make the move, I feel, a lot faster. And us as graduating dentists, we might find it safer to be in a corporate setting than to find it in a practice ownership setting.
They're really good points. And one of the things my team, last week we had Alistair McDonald on, who was he's one of Mark Costas's advisors, consultants, who's sharing a lot about a lot of great stuff here. Some of that makes a lot of sense, but just going back, so I sell practices to DSOs and private practitioners. So, you know, I got a practice, Dr. Nacho's House of Dentistry, DSO is going to pay $1 million, private practice $900,000. Does the owner sell to a DSO or not? That's a personal decision. It's really made, that decision's made on how long the owner wants to work after the sale. We have a great leader, one of the DSO groups on here too. But not all DSOs, they're just like every company, you know, sneaker companies, Nike, Puma, Reebok. There was a company called LA Gear when I was a kid. I don't know if they came back, but not all of them made it that long. And DSOs need money too. So they have to go to investors. Private practice owners have to go to a bank, but both places need money. So what you said, though, that there could be a great opportunity to acquire 3 small practices for 50% of what their value is, but they still need money for that. What will the risk tolerance be of their investors to do that? And that's a TBD. I see the DSO world's a lot of like, we learned as like biology, like a smaller fish being eaten by a bigger fish, being eaten by a bigger fish. So there might be some probably acquisitions there, but there also may be some investors that don't have the risk appetite for that as well. So really good points there. I think that's a TBD. I think you're going to see DSOs leave the space and other ones that may become stronger after this is reopens. They also, though, we have to think about it. So I have 2 practices. I'm a genuine, transparent person. I have 2 practices that are shut down like a beach bar, right? They're shut down. And my brother and I have to use a line of credit to keep them open because we have no other choice. Employees being paid by unemployment. When we reopen this beach bar, we are the ones working at it, trying to bring back our associates. Rob Montgomery says, like, we're really vested in the success of our practice. Are all the DSOs going to feel that way? Are they going to want to keep putting money into practices that are shut down right now? Because right now they're supposed to be getting returns for their investors. And if they're doing 10% of what they used to do, this is something that you guys really should just keep, be aware of as you make your journey through this space. And it's always about finding the right fit. It doesn't mean DSO is not always the right or wrong fit. Private practice, finding that right fit.
But in addition to DSOs, this could provide an opportunity for single practice owners to now branch out into multi-practices if they can get that purchase price down to a reasonable level that's even below what normally would be offered for.
The way that it's a really good point. The only way to do that, though, is what I've been saying since I started Dental Nachos and before it. The only way to do that is for dentists to collaborate and to take 3 practice owners who have $1 million practices and become a unit and then go and do that. But if you notice, in dental school, you guys all like each other. They make this dental student Hunger Games, and then when you get out of dental school, everyone gets weird in their own cave. You know, I'll say, here's one of my suggestions. I've said this all the time. I'll use Abdullah. So I need a part-time associate, and the woman down the street, Dr. Jennifer, needs a part-time associate. I said, wouldn't it be cool if I hired Abdullah 2 days a week and Jennifer 2 days a week? Then you'd work for both of us full-time. We both would get the ability to have an associate. We both can train you. Sounds pretty good, right, Jordan?
Sounds pretty good to me.
Abdullah? You know what Dennis say? I can't let Abdullah work for my competitor. They'll learn all my secrets. I go, what secrets? The Stamper bird? Is that the secret? We all got the same secrets. So that collaboration is going to be key. How will employer feel about someone who already signed a contract but now has a temporary license? Good question. Over this could avoid the contract. This is the key, dental students. I'm an equal opportunity annoyer. You guys, old dentists, young dentists, myself, this is not the time to be cheap. Get a dental focused attorney to review your contract. You could get in a bad situation. One of my own residents, who I love, I told her this job is going to be terrible. She took it anyway. It conservatively cost her $30,000 to have to get out of that job. So pay the $700, $1,000, $1,200. Ariel can connect you with our dental focused attorney. Nothing bad happens. That's you, Jordan. You finish your AGD. You have 2 jobs. I say, you got to take it to Rob Montgomery. You go, I don't want to pay $700 twice. I go, nothing bad can happen. Either they tell you, this is a great contract, let's tweak this restrictive covenant, great, or run from this. You don't even understand this language, but you see this here, they don't have to pay you if you're on this. So it's very critical to get that reviewed by a dental focused attorney.
I agree.
Any questions we didn't get to, just email salsa@dentalnachos.com. I'll bring these two awesome guys back on. Give me your parting thoughts here. I'm between two nachos. If you ever know that joke, Jack Galifianakis, between two nachos. Abdul, you go first. Any parting thoughts for the dental space, your fellow dental students, concerns, questions?
No, I've definitely used this time. I mean, we have a lot of time on our hand. Yes, we're focused on dentistry and trying to be better dentists, but this is also an opportunity to be a better human in just terms of like, I've been investing a lot more. There's a huge discounts in the stock market, even for a student that can like actually like, you know, buy in and invest and learn how to do it at a much lower risk, for example, than a couple of months ago, because they're much cheaper. And also like, don't just be like, you know, download masterclass, learn other things like story writing. Like right now I'm working on my statements for residencies and whatnot. I'm listening to Neil Gaiman talking about like how to write a story. So this is, you have a lot of time on your hand. And I know we're very concerned about dentistry, but my Monday, Wednesday, Fridays where I had, you know, clinic time, these are my time to grow as a person, not just and
that's
so
truly
that's
awesome advice. And I talk about working on your dental core, and that's just such good advice to do. I've said this, so whether you're a 42-year-old dad, young guys like you, we're never going to get this chance again. Never going to get this chance to be with my daughters all the time, but also be worried about businesses about this. It's a weird time, but there's these openings to do things that we wouldn't have gotten that chance to do. So really good insight to be a better human. I love that. And to work on things outside dentistry. What you said there, so I teach a lot of patient communication courses. Glad for you guys to take them, but that's not the only resource. There's podcasts, there's Tim Ferriss, there's Malcolm Gladwell, there's Seth Godin, there's so many outside Toastmasters to learn this type of stuff. Jordan, I'll ask you the same question.
Absolutely. So kind of like what you said, Paul, is that patient communication is one of the most paramount things in our industry. And right now, as a fourth-year student, I have so much time on my hands. And so now what I'm doing is I'm using my time to front load the process of basically practicing my treatment plan presentation. If a patient comes in and they have a crack on a crown or they need a deep cleaning, I'm practicing saying those things in a very concise manner to aid in treatment plan acceptance. And I think these things are things that you can just drill into your brain. So that way, when you are with the patient and you have the photograph on the screen, you can just go ahead and explain that in a short, concise, and clear manner in order to facilitate, you know, case acceptance further on down the line. And so usually we don't have so much time to just practice these things during dental school. But even when you are a dental student, case acceptance is already going to be lower because you have the inexperience against your side. You don't have a real dental license. You're the first time doing something. And so above all else, case acceptance is even more important as a dental student because you're trying to get your requirements.
So what you guys both say is so good. It goes down, and I'll add to likability and credibility. Neither of you are going to seem super credible young, but you can be likable. And here's what I'll wrap this into. I challenge you, I encourage you, you know, if I said, hey, Jordan, I challenge you to 47 pull-ups, you're like, what, half as many as I usually do? But I challenge you to download the app Loom, which I have on my phone, and it's a free app, and what you can be doing is 60 seconds or less is my challenge. First one you make about yourself. The one I made on my Dental Nachos YouTube page, modeling what I would do as a dental student, was 29 seconds. Hi, I'm Dr. Paul Goodman. I graduated from University of Pennsylvania School of Dental Medicine. I did a GPR at Albert Einstein. I really enjoy implants and restorative dentistry. I'm looking for a position in the Philadelphia, New Jersey area. You can reach me, paul@dentalnachos.com. I look forward to hearing from you. You make that. Loom makes instant links. It's free. And then I challenge you to make one a day, dental students, one about you, but then what you said, and you said, patient communication. Here's another one that you guys can just copy from me. People ask about insurance. Hey, my name is Dr. Jordan Brown. A lot of people ask me about insurance. Insurance is like a coupon, first sentence. A coupon that acts like a benefit. Insurance is not, dental insurance is not insurance. It acts like a coupon with blackout dates. We're going to do the best job possible to maximize the benefits of your coupon. You can make 4 or 5 second systems that you can use forever, not just for you guys, for your team, for your patients, and it always looks cooler on video. Like if you could have your own YouTube channel of just patient communication stuff that you can take anywhere with you, show employers, and you're going to automate annoyance. You want to automate annoyance. People ask you about insurance, make a video. People ask you why you look young, make a video. People ask you about, and practicing that is so critical. So you guys make those videos. If you guys make one, email me at salsa@dentalnachos.com. Ariel, Amanda, and Brandon will send you back a prize for your video. It's just like 18-month-old moderator who ate 14 chocolate eggs yesterday to start off our day. Awesome, guys. Really enjoyed being on it with you. We're going to jump off Facebook Live. We'll stay on Zoom here for a minute and let you guys get on today. Thanks, Dental Nacho's crew. All right, we're off Facebook Live. You guys are pros, Abdullah and Jordan. You're like regular talk show hosts. If you guys are watching,
you're a great moderator.
Oh, thanks. I love doing this. If you guys are watching and you have other people who want to pop on, we get more people, get D1s, D2s, female dental students, PGYs. I want to create a lane for the dental student world, from dental student to like first 2 years out, because the things that you're facing are just unique. And I've done a lot of teaching over the years, and I have the New Dentist Boost Camp, and I have other stuff. You can't get someone who's been a dentist for 25 years is not going to relate to what you guys are going through. So I want to create some safe spaces for you guys to discuss it. So,
thank you.
Oh, my pleasure. Ariel, Amanda, anything else on your guys' end?
Nope. I think we're all good on my end.
All right, guys. Abdul, Jordan, you guys are awesome. Go back to Instagramming, investing in stocks, doing push-ups all at the same time. See you guys later. Have a great day.
Have a good one.